everyone. Now we are going to discuss about a case study. Okay. So this case study is based about alcoholic patient. AUD, alcoholic disorder. Yes. Anyone just explain a case history about the person. Any person which we have already seen in our clinical interaction. Shall we do?
Okay. The patient name was Orpheus. Okay. He was now nearly 45 years old, a man, but he used to drink nearly 22 years from his childhood. He started like their drinks for enjoyment, like that. And after a few days or few months, he started to addicted that. And he wanted to quit that alcohol. He doesn't want to consume that. He got married and have some child, and he's living his married life peacefully. But because of this alcohol, he can't able to sleep properly. He can't able to speak with people, communicate with people. So he's seeing some difficulties to communicate with others. So he came to me and concerned this about with me, and he spoke with about his symptoms like he have auditory hallucination. Like auditory hallucination, he is thinking that no, I want to quit that. But while going to the bike or while going to drink some tea in the coffee shop, he is hearing like buy some cigarettes, take a puff, like that. If he is doing that, and after a few minutes, he is hearing that okay, go to bar, have some alcohol, it gives you enjoyment. Like that, often he is hearing like that auditory hallucination. So he was afraid that somewhat is going to happen. We have to quit it. He doesn't know what is the reason for that auditory hallucination because he wants to stop that. But in our mind, in our subconscious mind, some stuff will be stored. Like what are the activities we are doing that. But if we stop that, but our subconscious mind it will be stored. In that subconscious mind, he is hearing that auditory hallucination like buy that drink alcohol, be enjoy food in the way. That's how the problem he is facing. So he came to rehabilitation center to overcome his hallucination and to quit the alcohol.
So it is a detailed discussion about the case history related to alcoholic patient. What would be the problem? What would be the problem with the alcoholic patient face after he is addicted to alcohol? Like once he repeatedly doing this, taking alcohol. Anyone?
First and foremost, the major physical issues are like liver damage and heart issues. Heart issues may be that sudden heart attack or heart arrest. And then they have digestive problem also. Often they used to feel body pain and dizziness. After consuming alcohol within 12 hours, they feel dizziness. And psychological problems like anxiety, depression, and they have some fear, some kind of fear, stirring, they feel like that. After that, social issues, often family conflicts, they cannot work in their workplace peacefully. If there are children, they cannot study in their academic, they cannot concentrate in studying. And then the bad impression, if a person consuming benzene, they allow the people to judge him. He's not fitted to be a good in society. So these are the problems that we face.
So this is the problems they face almost with about like symptoms and causes we have explained. And what can be the treatment plan? What can be the treatment plan which helps them to overcome?
And like detoxification,
No.
detox body, detox, then music therapy,
Okay, music therapy.
meditation,
Yes.
counseling,
Yes.
behavioral therapy, then rehabilitation center, put the body.
So making them to place them in a de-addiction center and giving some medication, psychiatric medicines. With the help of medicine, they have some talk therapy, which helps them to touch their emotion, which helps them to heal their emotion. So that will do. And cognitive behavior therapy, CBT works foremost well. And mostly for alcoholic patients, CBT is the biggest therapy. Then other than that, anyone has any other treatment thing?
In rehabilitation for the alcohol patient, there not only the alcohol patient, for the patients who are addicted in drugs like alcohol, cannabis, and like other what are the drugs like LSD. In those peoples, the therapies are or the counselors are giving the talk about like what are the things they failed to attend. They didn't attend. They didn't experience that because of the alcohol. We are always some people are always from morning to evening they are always consuming the alcohol. So they doesn't know about the family emotions like wife, husband, their kids, their mother, father. They doesn't know about the emotions and love. So they are missing these all the things. In that counseling, they are telling that for the alcohol because of the consuming alcohol, you are missing those things like exploring with the friends, going to work. These are the this is not alcohol is not a realistic world. This is just like a just like for fantasy or for the enjoyment. So we have a realistic world. In that we have
Yes. Yes, yes.
here the counselor needs to test their emotions and giving relief from their